Nursing school is hard enough. Learning about cardiology just doesn't have to be. My name is Andrea. I'm a cardiac nurse practitioner, and I make cardiology make sense. Nursing students, new grad nurses, med-surg nurses, pull up a chair. Let's learn about ACE inhibitors. ACE inhibitors, angiotensin converting enzyme inhibitors. This is just one type of blood pressure medication that can be administered to patients either in the hospital setting or even in the outpatient setting. The way that ACE inhibitors work, they promote vasodilation, which means they tell the arteries of the body to widen. When you widen the arterial network, the heart doesn't have to work nearly as hard to push blood through otherwise tightened vessels, and that's what brings down blood pressure. Some of the things to watch out for with your patients who are on ACE inhibitors, there are 3, and it's hidden in the name, ACE. Use your acronyms. A, angioedema. Sometimes patients who are on ACE inhibitors can complain that they feel like their lips and their tongue beginning to swell. If that is what happens, if that's what your patient says, then tell them to seek emergent medical attention, because anything that has the capability of causing the lips and the tongue to swell, that can cause the rest of the oral mucosa to swell also, and that can compromise your airway potentially. This is an emergent problem, and they need to get to an emergent place for medical assessment. C, cough. Sometimes ACE inhibitors can come with a dry, non-productive cough. And while this is not life-threatening at all, it can be very annoying and can contribute to non-compliance with the medication. If your patient complains of this, then report it to the prescribing provider. Maybe some changes can be made in their medication regimen. And then finally, E, look for electrolyte imbalances. ACE inhibitors are metabolized by the kidneys, and one of the major responsibilities of the kidneys is maintenance of fluid and electrolyte balance. So for your patients with ACE inhibitors on board their medication regimen, especially if they're in the hospital, nurses, check your labs before administering. Look at their kidney function. Look at their electrolytes, specifically potassium. And if you see any signs of the kidney function becoming worse or the electrolytes starting to become unbalanced, doesn't matter if they're too high or if they're too low, notify the prescribing provider, because there may be some medication changes that are warranted. ACE inhibitors, remember, they work through the kidneys, right? They also have a very mild diuretic effect. Want to learn more about that? You're going to have to follow me. Hit that plus button right there. Like, follow, repost, share, all that jazz. I make cardiology make sense, and I make it fun at the same time. Join the class.